Welcome to Enhance Your Pregnancy Naturally. I'm Dr. Jordanna Clarfield-Henry, and actually today I am going to be interviewed by one of my very dear friends, Dr. Jodi Larry. Jodi is a naturopathic doctor, and she specializes in mindset, emotional depth, and learning how to sort of control your responses to things that come up in your life in a very healthy manner. She's also the founder and creator of a wonderful wellness community called Ritual. And everyone who gets the VIP bonus package will actually get a month free in this Ritual community, which is honestly worth the price. It is so uplifting and amazing, and you're connected with amazing people, and you get Dr. Jodi's expertise in everything natural health, wellness, and mindset. So welcome, Jodi. And I'm going to let you take it away because you're the interviewer.
Yes, I'm so excited. Thank you so much for having me, Jord. Excuse me, I am here to interview you. And Dr. Jordanna Clarfield-Henry has been a practicing chiropractor for 17 years. You look too young. Throughout your career, you've always had a special interest in caring for pregnant women, and that's what we're talking about today specifically. Dr. Jordanna has a fellowship with the International Chiropractic Pediatric Association, which focuses on training chiropractors to care for pregnant women and their children from infancy onward. She is also certified in the Webster technique, which we're going to explain, which I have no idea what that is, so I'm curious to know. Dr. Jordanna also owns and operates Health Haven, which is a clinic on St. Clair Avenue in Midtown Toronto, a multidisciplinary natural health clinic that offers chiropractic, acupuncture, massage, homeopathy, and yoga therapy. Interesting. Dr. Jordanna also has 2 boys and has used chiropractic care throughout both of her own pregnancies. Seeing the amazing impact it had on her own life, she became very passionate about helping other women go through this very important journey in their own life. Dr. Jordanna also realized that many people today are looking for natural solutions for their health, especially in pregnancy. And this is really what she wants to focus on today in her talk and in general in her career. So she's decided to gather together experts in the area of preconception, pregnancy, and postpartum to bring you this summit. It's called Enhancing Your Pregnancy Naturally. And today we're going to be talking about the advantages of prenatal chiropractic care specifically. So I'm excited to learn more. So what I'd love to know first is, why would a pregnant woman even think about seeing a chiropractor? I mean, obviously we all get back pain when we're pregnant, but why would a woman go see a chiropractor, and when?
Sure. Well, there's 2 reasons that a pregnant mom will go see a chiropractor. The first one is pain motivated. So they're pregnant and they've got low back pain, or they've got sciatica, or even pain in other areas, maybe unrelated specifically to pregnancy, like neck, shoulders, back. So they go to see a chiropractor because they've got pain and they happen to be pregnant. So they would prefer to see somebody who's trained in treating pregnant women. So that's why you would seek out specifically a prenatal chiropractor who has the specific training, like me. And there's a lot of people out there that have prenatal training. And then the second reason is that they've heard that chiropractic care can keep their body in shape while it's going through all the changes in pregnancy. So, and that would be driven mostly by referral. Like a friend said, oh, I used a chiropractor during my pregnancy, you should too. Or their mom, or their midwife, or OBs. A lot of people do know about chiropractic care. So they've been referred, and they don't necessarily have pain, but they've heard that chiropractic can help in some way make for an easier pregnancy.
Okay. And do you recommend that people would see a chiropractor preventatively, or just when they're in pain?
So I always like preventative care. I mean, I think that is the optimal thing to do. Why wait till you're in excruciating pain when you could maybe do something that would prevent that from happening, right? Because pain is debilitating, and who wants to get in pain? during pregnancy, my own personal experience during pregnancy, I treated pregnant women all the way through my 17 years of practice, but I only got pregnant, 11 years ago. So I only had personal experience starting 11 years ago. And what I can say is this: my first pregnancy, I was working with another chiropractor, so I kind of just slipped into her schedule whenever it worked out. So I didn't have it as often. And I had moments of pain, and I had moments where I was like, oh God, I really need an adjustment, or I need a massage or something, right? With my second pregnancy, I was like, what am I doing? I focus on this, like, this is my specialty. Why am I not doing what I'm telling my patients to do? So I went to a chiropractor. Now I went weekly because I'm working physically on people, and you don't have to go weekly in general, but I went weekly and I had no pain, almost no nausea. Like, I had a much better pregnancy experience the second time around because I did it more preventative. And that really gave me a drive to really push. So whenever I know my patients are pregnant, or if they tell me about someone, I really recommend that you should get on some kind of prenatal plan with a chiropractor or your chiropractor.
Yeah, no, it's really good for people to know who are watching, who are maybe getting pregnant or going to get pregnant for the second time or third time or fourth time, and would want to do it differently, right? Anything is better preventatively. Most people sadly start the care when the pain comes, but if you can be wise enough to do the preventative care, it's very important.
For sure. And like, preventative care doesn't mean you never have instances of pain. It just means that you're on top of your body. And when the pain comes, if it comes, because we slip, we fall, we exercise, we pick up heavy things that we shouldn't pick up and all that stuff. So pain can come, but if your body is already kind of prepared and used to getting chiropractic care, like, treatment is so much easier, and the time spent in pain is less, and like the degree of pain is also less if you have something come up also. So preventative doesn't mean you never ever get in pain, but it means when you do, the time spent there is way less. You've already got your next appointment booked. Like, it's really fast out of that situation as well. So that's another great thing about preventative care.
And what are some of the benefits of chiropractic care during pregnancy? What can people expect?
So first thing is, for sure, we're going to reduce incidences of pain. Like, a lot of pregnant women, especially in the third trimester, as the belly's really big, then they get low back pain. Some people get sciatica, some people get rib pain, all that stuff. So having chiropractic care is going to reduce that or eliminate it. Then the other thing is, a lot of it's anecdotal because we don't do studies on pregnant women, because number one, it's sacred and we don't want to do anything, and you never want to give placebo, which is like a fake treatment to somebody during pregnancy. So a lot of this stuff is anecdotal. So I'm going to say chiropractic care may help with these things. It can reduce nausea, which I experienced myself. It is reported that it reduces labor and delivery time, so the time spent, and it also is reported there's a lower risk of need of intervention, because when the pelvis is aligned, which is what pregnancy chiropractic care is really focused on, then the womb or the uterus is wide open and in its nice big egg shape. And the baby has all the room inside to do what it's naturally supposed to do, get in the right birthing position, and like less likely just for things to happen that are scary. Now, this
I wish I knew about this before
yeah, it would have been good. And there are some reported like less recovery time postpartum, especially if you continue and go see your chiropractor a couple of weeks once you're ready to get out of the house postpartum. So, because we go from with that big belly and now that baby's out and our tummy's shrunk and now we're carrying the baby up here. So postural changes are huge, and center of gravity changes and everything. So to go out and get aligned right after the baby comes is also awesome. And if you've got a ICPA trained chiropractor like me, you can bring your infant in and I can even check your infant and make sure everything is aligned. And now a lot of people are scared about infant chiropractic, and that's not what we're talking about today. But I just want to say it's super safe and gentle, and there's no cracking. It's not like adult chiropractic at all.
Mm-hmm. Interesting. I wish like I said, I knew about this. I had a lot of problems with my first pregnancy, and probably because of the way the pelvis was aligned. But anyways, so I know a lot of people, would come to a naturopath for breech baby. We have different acupuncture techniques, but what types of things can a chiropractor do if the baby is breached to turn it around and hope for a natural pregnancy?
Totally. Great question. So there is something that we're trained on called the Webster technique. Now, we talked about that in my intro. The Webster technique is a pelvis balancing technique. We do some ligament release and we do some alignment, which are very gentle, what we call drop adjustments. And there's no cracking involved there. It's just the pregnant mom we have special pregnancy pillows. The mom lies right on her tummy and it's nice and cushioned and it's super comfortable. One of the only places you get to lie on your tummy when you're pregnant. And we check mom out and we are looking for a specific misalignment. We correct that misalignment and everything is balanced. Now, I don't turn breech babies. I can't turn breech babies, but what I can do is make sure mom's body is in optimal positioning, meaning the pelvic is balanced and all these ligaments that I release are actually connected right into the uterus. So when they are released, it sort of relaxes the uterus. So the uterus can get tight. If the pelvis is misaligned, it can sort of torque a bit, twist a bit, and baby doesn't have enough room in there. And so baby's going to be stuck because they don't feel like they have the space to turn over. So when we align the pelvis and release those ligaments, we get this nice open uterus and the baby goes, oh, I got lots of space. I can stretch, I can move. And the baby goes into the position because it's just the natural thing for a baby to do. Now, there are some factors that will limit the success of the Webster technique. Number one is, when do you come see me? If you're coming to see me the day before that you're going to be induced because your baby's breached, I probably can't help you. Although I would still say come, because if I align your pelvis and we got your nervous system flowing better, then you're going to still have a better outcome and recovery anyways. But if you're looking for the potential for that baby to turn on its own, you want to start getting chiropractic care in the baby's breech around 32 weeks if you're not already under prenatal care. So that gives you a good 4 to 6 weeks, even 8 weeks if you go all the way to 42, like me with my first, to get that baby to turn, right? Yeah, so the more time you give. And then there's also some factors, sometimes babies get twisted up in there. The umbilical cord is short or it's wrapped around them in some way. In that case, the baby will sense it's not safe for them to move. And in that case, still go to see the chiropractor, get the Webster technique, and everything, your body at least will be in better preparation for an easier birth, even if it's C-section and recovery. So it's you never don't have to go see the chiropractor for this. It's just, they say the percentage of babies that actually do resolve into the right position is about 85% of the Webster technique. So that other 15% are the exceptions to the rule. Yeah.
Interesting. So we talked about preventative care and, people should come right away when they get pregnant to work through the pregnancy to decrease the pain. But would a person come to see a chiropractor before they get pregnant? And
Sure, yeah.
Help with fertility issues? I guess that would be another question.
Yeah. So again, like the goal always of chiropractic is we are aligning the body. We're making sure that all the joints are moving the way they're supposed to be moving and are in the proper alignment. Okay. And the reason for that is because the spinal cord runs right through that spine and it connects the brain to the body. So you want that spine to be as straight as possible, which, it's never 100% because we're humans and we're not perfectly put together. Nobody's perfectly 100% balanced, but the straighter everything is and the more proper motion you have at every segment, it means the messages are getting from the brain to the body faster, okay? If you had pelvic misalignment or misalignment in the lower part of the nervous system, those nerves all go into the pelvis and supply all the uterus, the cervix, the vagina, all that stuff. So if you are having trouble getting pregnant and you are misaligned, and some of those nerves are not getting the messages 100% to the uterus, the ovaries, the fallopian tubes, all that stuff, then yes, if you had some adjustments and got yourself aligned, got that nervous system flowing better, and those nerves are freed up, then we do see that some women get naturally pregnant, or their IVFs or other fertility treatments work faster, better, and hold. So I'm not making women more fertile. I'm making the body function better and the nervous system work optimally so that all those systems are working better. And so, yes, I have had a lot of women have increased fertility from chiropractic care.
Amazing. That's so important to know that that could be a factor and or an assistance, because I know infertility is very, very, very on the rise right now. Do you see a lot of that?
Yes, I see a lot of women who are going through fertility treatments. And so when they share that information with me, then I do focus on the pelvis and the low back and make sure all of that extra care, because some people are coming to see me for neck stuff, shoulder stuff. So I'm concentrating on that area. If they let me know that fertility is something they're doing, I will spend some extra time on that lower body and make sure it's flowing. Even if they don't have any pain there, we can still do work on the body and make sure it's perfectly aligned.
Mm-hmm. Okay. And what would chiropractic care look like for a pregnant woman? I know, some women are afraid of cracking or getting their neck adjusted or certain things. Is chiropractic care the same for a pregnant woman versus someone who wasn't?
So if a woman has already been under chiropractic care, and they become pregnant, I'm going to continue checking full spine and adjusting them because they're used to being adjusted. Okay. And so that they won't have a problem with it. But if this is your first time seeing a chiropractor and you're terrified of being cracked, there are so many other options, first of all, that do not involve cracking the body and still align the body. So I have a few different techniques that I use, that I have some instruments that I use that help to adjust without cracking. I also use a table that has these pieces that go down like that, so we can actually put an adjustment through with that drop. We get the adjustment to go through without any cracking to the body as well, and no twisting. Okay. And if I get someone coming in for prenatal care and they are like, please do not touch me anywhere from, like, let's say rib cage and above, then I don't touch them there. It's not necessary for me to work on the upper body if we're just focusing on prenatal care. So those are good reasons to not be scared. And because we don't have to do cracking. Now, I do often recommend and check women full spine because we have stress, and stress is all up here. And we've got lots of other stuff going on in our lives. A lot of us are on the computers these days and on our phones and like that, right? So a lot of people do have some stress in their upper body, but if they are not interested in having those cracking adjustments, then we don't do that, first of all. And then there's the focus of the prenatal care, which is super gentle, ligament release, pelvic balancing, not pelvic cracking, but pelvic balancing. And basically what I do is, if they're coming at the beginning, so if I'm seeing them from conception or once they know they're pregnant.
Jordan, can you pause this for 1 sec?
Yes.
I just need to get water.
So let me just give you a brief overview of what a prenatal, like, chiropractic plan would be. And you can start chiropractic care at any time, right? You can start before you're pregnant. You can start anytime during pregnancy, even, like I said, the day before you deliver. And if you've just had your kid and you feel like your body needs some adjusting, then go see one now. Postnatal is fine too. I treat lots of people who are not pregnant, and most chiropractors don't just exclusively treat pregnant women. So anytime is a good time to go. But let's say you're lucky enough to be watching this and you just found out you're pregnant, and so you're in first trimester. So chiropractic, you would go in for your initial assessment, which is like an hour. We do a history, a physical, and a treatment. And then I would opt, if you have no pain and no problems, then you're just going for that preventative wellness care, then I would see you once a month until about, whoops, I got a little fly here, until about halfway through your pregnancy. So up to 20 weeks, we're going to go once a month. So once every 4 weeks, let's say. So you'd have about five treatments over the 20 weeks. And then we are going to move to a little more often. I recommend doing biweekly care from there until about 32 weeks. And then once we get to 32 weeks, you want to come once a week, because you're growing so much in that last little bit. Yeah. And it sets you up. And if there's any issues, like the baby is not quite turning, we're already on a good schedule of care there to take care of that. So that's like ideal wellness pregnancy care. Now, if you have pain, when I see you, no matter where you are in pregnancy, I've seen women with pain in first trimester, and I've seen women in pain in their last trimester. It doesn't matter where you are. We're going to have a more intensive schedule to get you out of pain. So if I have low back pain with sciatica, like pain down my leg, then I'm probably going to see you 2 or 3 times a week until it's gone. And then once it's gone, you just go back to a regular whatever care during the rest of your pregnancy. So when we're in pain, we want to get out of pain. So we're going to focus the care, and then you go back to a normal schedule. And if you were coming in no pain, baby's breech, again, we're going to do an intensive amount of care. I will see women 3 times a week then for the Webster technique, specifically if we're looking at seeing if we can get that baby to turn into optimal birthing position. So I'm going to see 3 times a week. Every time I'm in that clinic, you're going to be in that clinic until we see movement of the baby. And then again, if we got movement of the baby at 35 weeks, I would still recommend mom come in once a week after that to keep mom in optimal positioning and baby in optimal positioning. So that's sort of how prenatal care works.
And then how long after, once the baby comes, you said you also recommend that the mom?
Yeah, so if you have a normal vaginal birth and you didn't have too many complications going on in there, then you come in whenever you're ready. So if you're ready in 2 weeks, come in 2 weeks. If you're ready in 6 weeks, come in 6 weeks. Whatever it is, it's up to the mom. If you've had C-section and you've got, like, you need to recover from your scar, you can't get out of bed or anything like that, then you want to wait the 6 weeks till that they recommend till you're good. Although I do see women sooner if they've healed faster. Sometimes they heal faster. I do recommend, though, if there's a lot of pain going on, just get in as quickly as you can. In an office like mine, you're going to be okay to bring in your infant with you. And especially in the first bunch of weeks, the infants are sleeping most of the time. It's really not a big deal to have them in my office. I also do not mind any children ever coming in with their parents. So I always make it very convenient. And if the kids are, let's say 2, 3, 4, I actually interact a lot with the kids. I get them to be my little helper. We get them occupied while mom's getting treated so that it's a really easy process. And the kids never bother me. Hence I have a prenatal and pediatric practice.
Yeah.
Yeah.
Amazing. And what would baby chiropractic care look like? Like, how often would you need to adjust the baby? How long does that go on for? Do you recommend that preventatively?
So I like to check the babies after they've come out of mom. It's whether it was a C-section or a natural birth or an assisted birth, meaning they had forceps or vacuum extraction or whatever. It's really hard. That baby is coming out head first. There's a lot of pressure on its little body as it's being squeezed from the top, and it's got to squeeze out of that hole at the bottom. So there's just a lot of pressure on the babies. And there's a lot of common little itty bitty symptoms that everyone kind of thinks are normal that are an indication that things are slightly misaligned. Meaning, like baby chooses to feed on one side only and fusses on the other side. Or anytime you lie the baby down on their back, baby freaks out. Or when you do tummy time, baby freaks out. Or colic, for example, which, sometimes starts a little bit later. Sometimes formula fed babies, they tend to sometimes have some constipation and stuff like that. And babies only showing that something's uncomfortable for them is that they cry, right? And crying is stressful for parents. So anything that is causing parents stress can be looked at. From a chiropractic perspective, babies don't need very many adjustments because they're brand new. Their nervous system is wide open and they have no thoughts about it. See, grownups are hard to treat because we analyze everything. We have an opinion. We've decided if it's going to work or not. We've decided how we want to be touched and how we want to be moved. And babies don't have any of that in their way. So I often see babies once. I think the most I ever need to see babies has been 6 times. And that's when something really has gotten very stuck. And usually that happens because baby was in a strange position inside mom, like maybe all like this. And when they come out, they're still like that. And so we want to kind of unwind that pattern in their nervous system. So that might take a few more adjustments. And also another one is tongue tie issues. Once you've had the tongue tie release, often the babies are sent to physios to work on it, but chiropractors are also very good at working on releasing the jaw, making sure there's full function in there. So if you're already under chiropractic care, you could take your baby to the chiropractor and we would do very similar stuff to the physios for releasing that jaw. Post tongue tie release as well. It's very helpful. And if you're trained in cranial work, which I am as well, you can also do some release on the palate and everything like that. So get the baby eating and feeding better, faster, sooner.
What is that? Cranial work?
The palate work, yes, it's cranial work because all the bones in the face and the head are cranial bones. This is our cranium. So I actually, for a baby release, for palate release, I would actually, well, on babies, I'd use my pinkies. But for a grown-up, I would use thumbs. And we actually put our fingers up in the baby's mouth and work on it. Now, obviously, I would be gloved. The babies don't love it, but honestly, it takes 2 seconds and it makes a big impact.
Cool.
Yeah.
Very interesting. Very interesting. So anything that you feel is important for pregnant women to know as they're starting their journey? What advice would you want to give them, being a mom and a chiropractor yourself?
Yeah, I just think that it's super important, especially during pregnancy. I mean, in life, it's really important to be as healthy as possible. But during pregnancy, women really take that onus on because they want to create a healthy environment for that baby to grow. And I think if we can get more women using natural healthcare options first, we're going to have a lot less people needing to go to hospitals and using medication and all that stuff. Now, I'm not saying chiropractic is going to prevent the need, or seeing a naturopath is going to prevent the need for all medication use and stuff, but there is so much stuff that we can do that is in a preventative and more along the lines of natural wellness care. And I don't know, when I was certainly more driven when you're pregnant to follow that kind of path. And you really want to set up that baby to have a healthy environment, because everything you put in your body is going to the baby, or the baby's taking from you, and you need to replenish yourself. Also, I feel that so many women, when they're pregnant, they're just like, oh, it's pregnancy. Like, oh, I like pee a bit when I when I laugh or cough or whatever, and we think, oh, but that's just because I'm pregnant, or I've just had kids, so it's just normal. And women will think, okay, so the baby's in a weird position, that's why I have pain, it's just normal. And I just want to say that there's no reason to have pain during pregnancy. It's a natural process. And like, women have been doing it for thousands and thousands and hundreds of thousands of years without modern medicine. So back in the day, 2000 years ago, women were doing things like, now it wasn't called chiropractic back then, but they would have people that worked on the bodies. Plus we were also moving around. And this day and age, we are not moving as much as we have before. So sitting at desks and sitting in our cars and all that stuff makes a sort of puts our bodies in weird postures for long periods of time that is aggravating. So don't suffer. Don't just chalk it up to, oh, this is what happens during pregnancy. Get it checked out, because why wouldn't you make sure you're feeling as your best? Just because you have a baby growing inside you doesn't mean you have to feel like shit.
Yeah, it's like we think it's normal, but it doesn't have to be that way. There are things that's so important for people to know.
Yeah, it's just
Especially
especially pregnant women, because I mean, there are some women who experience intense joy and they just love the whole experience of being pregnant, and that's so wonderful, and lucky them. But there's a lot of women who go through lots of periods of time during pregnancy that are uncomfortable, they're gassy, they've got heartburn, they're in pain, and like, it doesn't make pregnancy necessarily enjoyable. And I want women to know that it's okay to not enjoy it all the way through the entire time, because we're nauseous, we're puking, we're this, it's not necessarily the most exquisite time of life. It's a miraculous time of life, but it's not necessarily the best ever. Obviously, the results of going through that are you get this wonderful, beautiful child, either to keep for yourself or to give to parents who can't have children of their own. And so don't suffer. If you're not enjoying, seek out ways to treat what's bugging you.
I love that. So important. Thank you so much. Anything else that you want to share before we finish up?
Well, I think we covered as much as I could. For sure, if anybody has any questions at all through the summit, please contact me. I am the original host of the summit. So all the emails come into me. So if you have any more questions about prenatal care or any of our other speakers' topics, please feel free to email me and I will get that information out to the right person and get you answers to your questions. If you are lucky enough to be in the Toronto area, I am at 568 St. Clair Avenue West, and I am available all the time. So if you're looking to get some prenatal chiropractic care, I've also included in the VIP bonus 50% off your initial treatment. So our initial treatments are $140. So I'm giving it away for $70. Wow. To anyone who joins, who comes to see me, who's watched the summit and purchases that VIP package, which also includes I keep getting that little fruit fly in my face. Anyway, so the VIP packages includes gifts from all of our speakers. We've got tons of amazing PDFs with more explanations on natural solutions. We've got partner positioning pictures. We've got something from our naturopath. I mean, they can join the Ritual community for a month and check that out. And lots of percentages off treatments with people if you're in the Toronto area.
Amazing.
So yeah, it's a great, great package.
Amazing. Anything else you want to tell us before we finish up?
No, I think this was amazing. And I am so, so thankful to you. Thank you for being my friend. Thank you for being one of my mentors. And thank you for taking the time out of your busy life to interview me here. I really appreciate it, Jodi.
Thanks for having me so much. I really, it was fun. And it was good for me to learn. To be honest, I didn't know a lot about chiropractic care and pregnancy, and now I know more. So I wish I would have had you, but I'm not getting pregnant again. So
yeah, all done. Done with that.
Happy to pass along the information for others.
Yeah, exactly. Okay. Well, yeah, this was wonderful. I had so much fun. Thank you so much.
Okay. Bye, George.
Bye.